Welcome back. This is Monica. Is one that, many gentlemen and very older gentlemen really try to avoid because of how matters screening even. It is prostate cancer awareness. And this particular morning, we're joined by Dr. Rajesh Chowthari. He's a consultant urologist and andrologist at Al Jalram Hospital. Welcome, sir.
Thank you. Good morning. How are you?
I'm good.
It's a very nice morning, sunny morning, huh?
Yes. You can give us a brief intro of who you are before we continue.
I'm Dr. Rajesh Chowdhury. I'm a urologist and andrologist by profession. I did my training from India at a prestigious institute called Institute of Kidney Disease, which is one of the best institutes dealing with urology and kidney problems. So I have experience of more than 20 years. I'm in Kenya since last 6 years, and I'm been treating patients all across the age, ranging from pediatric to old age. And I'm attached to this Jalaram Hospital since last 1 year. That's it.
All right, fantastic. Now, because this is a conversation that cuts across, we'll again also try to balance even the language that we have and just use the very basic, tukiombia watu kama ni rectal examination wanaelewa this is what we are talking about. And that again it means that you can always be part of this conversation. You can always talk to us. 2047 is our SMS number. So go up, just talk to us, text us, and ask Dr. all those questions you have concerning prostate cancer. You can also call in live. 0795 045 864 is the number. 0793 267 279 is our WhatsApp number. And so, Dr. as we continue, we'll be taking a look at what, first of all, even before we begin with prostate cancer, as you also tell us what it means, the anatomy of where prostate cancer really is. Paint us for a picture, as that picture.
Okay.
You
see, prostate is a male, basically, organ wherein the fluid for the semen is produced. It produces the fluid which gives nutrition to the sperm, which is usually help for fertilization. Prostate is a very small gland which is situated at the neck of the bladder. It's like a size of a walnut. Okay, it is just, you see the bladder is like this. It is lying at here. So the prostate is very crucial because it is lying at the base of the bladder, and from the prostate is the urethra which is passing. Okay, so prostate is engulfing the urethra. Okay, the basic size approximately is from 15 to 20 grams at a normal size. Okay, but as you grow old, like when you are going adulthood, there is a hormone called testosterone, which is a male hormone. So as this hormone production increases as towards your adulthood, there is a growth of prostate which you will see as you grow older. Around 40 to 50, the maximum growth of the prostate is you can see in the prostate gland. So now the most crucial part, prostate is going to enlarge, okay, as all males are going to grow old. Now the most crucial here is the enlargement are two types, either is a benign or is a cancerous. Now benign enlargement is a place wherein it enlarges and it blocks the urethra. So urethra becomes narrow and the flow of urine is affected in most of the males around 50. You will feel that your flow is decreased, you have to go get up in the night, you have frequency of urine, okay. So all these symptoms are because of the obstruction created by the enlargement of the prostate. That is called benign prostatic enlargement. Now, when in a body, there is a balance created by God, wherein the cells multiply and die. Every day there are new cells formed, and at the same time, old cells die. Whenever this balance is disturbed, maybe because of nature, because of a diet pattern, urbanization, all those things, mutation, you never know. Then the cancer starts. So when this balance in prostatic growth is affected, it is going toward cancerous side. So this is a basic physiology, you can say, or anatomy of the prostate, how it affects. It is going to affect all the males. Let that be very clear. Okay. So if you are reaching around 50, you have to have in mind that something is going around in your prostate, and we need to check what it is. That is the basic thing for all the males, whether it is affecting your flow of urine, whether it is affecting your sexual health life, whether it is affecting your maleness. All this thing is going to affect all the males because of the prostate.
So this is a conversation to all the males you mentioned?
All the males. Not 50, I say from 40 onwards.
Of 40 onwards?
Yeah.
Right. So someone like me who's in the mid-20s, you shouldn't really worry?
No, you have to worry. There is something called infection in prostate. That is called prostatitis. That affects sexually active male from 30 to 40. Okay. Now what happens in that? There is an infection which goes from urine into the prostatic part. That is called prostatitis. So most of the young active males will suffer from that one or the other time, may not be. So when you have those symptoms at a younger age, like 30, 35, that there is a burning of urine, there is a frequency, there is a fever. So you have to think of that you might be having some infection in the prostate and you need to see a urologist.
Right. Yeah. So thank you for clarifying on that as well. That also factors in on the whole risk factors that we can take a look at. First of all, you've definitely helped us understand this called international cancer of
that's what I told you. It's a small walnut size. You can see that red color is the bladder. Okay, and the yellow color down is the prostate. Now you can see the urethra is coming from the prostate down. It passes through the prostate. So prostate is like engulfing the whole urethra. So whenever there is any problem in prostate, it will be reflected in your urinary flow. So that has to be very, very clear in the mind that any problem in the urine, first of all, you have to rule out prostate, especially if infection is there, then you go to bladder and to kidneys. So prostate, you can see, is a very crucial part for all the males. And it is just like walnut size, small, around 20 grams, lying at the neck of the bladder.
And I know we'll get to the symptoms a little bit later on, but then the fact that you mentioned, so even for this age gap, between 30 to 40, 40 to 50, and this also is it resembles what even on the SHIF, Social Health Insurance Fund, for men who are above, I think even below 40 years old, they really have to even pay for, it doesn't cater for men who are at that age. And it's the same as what you're telling us. They are mostly not
catered. The services are not for the male, less than 40. So that's what I'm saying. Less than 40, most likely what is going to happen is basically infection. So in that case, mostly surgery is not needed. You might be needing treatment in forms of antibiotics, IV antibiotics, all those things, anti-inflammatory to cure an infection. Because you see the prostate, as you see here, the ejaculatory ducts from where the semen comes, sperm and semen, it passes through the prostate and then it ejaculates in the urethra. So prostate is also involving whenever there is some problem in the ejaculation. Maybe the infection in the sperm, the blood in semen, all those things also affects young male who are sexually active.
Right. You had mentioned the first one on the older age, mostly after age 50. You can also walk us through.
But I would like to tell you that the most commonly after 50, when the enlargement of prostate happens, wherein there is a balance is not maintained and there is a abnormal growth of cells, it goes toward cancerous side. So mostly after 50 you see that. But you see, if you have ancestral history of African descent, there are chances of prostate even at the early stage, maybe around 45 also we have seen. Recently I had like 3-4 months back a young male around 48 having a PSA around 26. We did a radical prostatectomy for the guy. But you see now, 48 is too young to have a prostate cancer. But he is totally cured now. That's the good part. Because he was an educated person, he did his PSA and he was cured. So I want to point out that if you have an ancestral history, like if you have family history of any cancer, may not be prostate, maybe a breast cancer, cervical cancer. Always there are chances of mutation in the genes in the family. So those people should go for early screening. And also having African descent should go for early screening because there are chances of early cancer, that is one. Second, the cancer which is there in those people, they are very aggressive and advanced. So that is what you are telling, 50 is the cutout, but I will suggest 45 should be the age for early detection.
And you've already tackled even for the race as well as even for the family history. And now even for obesity. Walk us through, because here, I mean, obesity is really subjective. When you take a look at even someone's BMI, walk us through, if someone is listening to this morning and they're wondering, I weigh this or my BMI is this particular figure. So what again is should be the standard figure, because I mean, according to National Cancer Institute of Kenya, it says people who are obese may have a higher risk of prostate cancer compared with people who considered to have a healthy weight. So again, it's a whole interesting bit again on matters healthy weight. On the same, remember you can always talk to us on our socials, 22047. 0793 267 279. Our phone lines are open, 0795 045 864. Healthy weight versus people who are obese.
You see, there is a study done by association, okay, wherein it shows the urbanization. You see, if you see your grandfathers, your fathers, what they were eating, what was their lifestyle, okay, and you see ourselves.
Yeah.
So because of this radical shift of the diet pattern towards non-vegetarian foods, towards more of processed foods, has given us an epidemic of obesity. You see, it's not a disease, but you see a lot of people having overweight. Okay, so obesity per se, it is risk factor for all of the things, right, from your lifestyle disease to any side of cancer, because of diet pattern. Now, if you're having more of processed food, it has a lot of chemicals inside. It is contaminated with a lot of pesticides. Okay, and those things causes changes in your body hormone levels, body structure, body chemical composition, and that can cause mutations and all those things, which leads to abnormal cell growth. So that is what obesity per se has effect on your high risk of cancer, maybe not only prostate, any cancer.
Right. Yeah. What are some of those misconceptions in your many years of experience that you mostly hear people come to you and say, I might have prostate cancer because of my certain lifestyle, and you tell them, no, that doesn't work here.
We see so many young people coming, looking into the data and media, all those risk about cancer prostate, that my lifestyle like this, I have multiple partners, all those things are there. So I tell them, whatever is there, it doesn't mean that you are going to have cancer, but it is better to have a screening, early screening, because any lifestyle doesn't pinpoint you that you are going to have a cancer. Okay, but early screening in the sense, a regular checkup of your body, regular checkup of your different organs, maybe liver, lung, colon. You see colon cancers, they are also very high. So you have to go for a regular checkup of your body so that you can early diagnose those things. There is no particular say that this lifestyle is going to make me, but a healthy lifestyle, like healthy food, bit of exercise, less of stress, proper sleep, it all helps you to regenerate your body and balance your organs. Yeah.
All right. On the next slide, we're taking a look at how it really develops. Still according to National Cancer Institute of Kenya, which tells us that prostate cancer develops when abnormal cells, the prostate gland grow in an uncontrolled way, forming a malignant tumor. Break this down for us.
Yeah, you see prostate cancer all over across the world, it is maybe second or third cancer in the male. But in Kenya, prostate cancer is number one for the males. So that is one is very much, you have to be very serious in looking into that data. And this, as what I suggested you, are the abnormal cells. As I told you, in the body, every day, thousands of cells die, thousands of cells are new formed. So there is a balance created by the human body that is called apoptosis. Whenever there is a disbalance in this thing, so the abnormal cells, instead of dying, it keeps multiplying. So when this keeps multiplying, it leads to formation of a small growth that is called a nodule or tumor. So that abnormal cells in a shell, it is called a nodule or a tumor. So that is what is malignancy. That is what you call malignant tumor.
All right. So now, still on matters even how it's developed, for now spreading. Does the tumor remain on the prostate, or does it spread to other parts of the body?
Yeah, as you see now here, the prostate, you can see it is encapsulated by a capsule. There's a wall. So when the growth of cells are there, it is going to grow. It is not going to stop. So when the growth is confined in the tumor, in the prostate itself, it is a localized tumor. Okay, and when the growth, it crosses the prostate capsule, it reaches the adjoining organs, maybe your tissue, your bowel, your bladder, it is called local spread. And when from there, it goes to your lymph nodes, to your different organs, it is called metastasis. That is how we do staging and grading of the prostate cancer. So the most important part for the prostate cancer also I want to tell you is the hormones, that is testosterone. Testosterone is like a fertilizer to the cancer cell growth for prostate specifically. So for the male hormone, testosterone gives fertilizer for the abnormal cells to grow in the prostate. So that's why whenever we treat a prostate cancer, we look into the testosterone therapy, how we can help so that the growth of the cells can be controlled.
Right.
Yeah.
I want to try this with now the next slide on symptoms, because earlier you've told us that even for early detection, when it's easy to cure totally, during early detection. So when someone presents this symptoms, you've already mentioned even for the bone pain, when it spreads to the bones, there's also trouble urinating, frequent urination, decreased force of urination, difficulty starting or stopping urine system, rather the stream and blood in semen, as well as pain or discomfort in the pelvic area. So at what age, or rather at what stage is someone when they present either all or some of these symptoms?
Yeah. Let me come back to my initial thing, what I told you. The prostate affects male throughout the life, starting from 30 to 60, let's say. So in the early 30 to 40, most likely is the infection in the prostate, which is called prostatitis. So whenever you have infection, all symptoms will be seen in that case also. Okay, when there is a benign enlargement of prostate, these symptoms will be seen there also. When there is a cancer, these symptoms will be seen there also. So basically it is a symptoms which is qualified, or which is what you can say, it is given for any patient who are having prostate enlargement, maybe as an infective, maybe a benign, or maybe a cancerous. So if a male from 30 to 40 has these symptoms, now why these symptoms happens, as I told you, prostate is engulfing the urethra. So whenever there is an infection, there is a swelling in the prostate. So it also blocks the flow of urine. So whenever urine tube is blocked, there will be difficulty in passing urine. Urine will not clear completely. So you will have frequency of urine. And because of infection, there might be some bleeding in the prostate. So might be blood in the urine or blood in the semen. So these all symptoms you can see in infective swelling of the prostate also, that is prostatitis. Okay, when you have a benign enlargement in male from 50 to 60 or 40 to 60, all these symptoms will be there. Now coming to cancer, in prostate cancer, in early stages, you will not have any symptoms, none of this. Still you might be having a small enlargement of prostate or nodule inside the prostate. So per se, you cannot diagnose early cancer so early because of any symptoms. The symptoms like blood in semen, pain in the back here, it could be because of the metastasis. When the growth of the prostate spreads to the bone, it causes bone pain. So pain doesn't mean that you have something related to back. It can be cancer prostate inside, which you might be missing. So that's why screening is very important for cancer prostate. These symptoms, if you feel anytime, you immediately you have to see a urologist so that he can check. There are basic simple tests by which we can check. So he will screen those things and we can know what you are suffering from, maybe a benign infection or a cancer.
So for the early stages, as you're saying, there are no symptoms?
No symptoms.
So there's no way that you can...
No, there is a way for screening.
Which now we'll be getting to that. But then I want to wrap it up on the whole slides, just taking a look at the numbers, just to show how big of a deal this conversation really is. And still according to national... Now this is according to World Cancer Research Fund International. So in 1,467,000 is about the new cases of prostate cancer in 2022. 300,430, the number of annual prostate cancer deaths worldwide. First of all, when you take a look at this, because when this research by the World Cancer Research goes on to show that in the next about 10 or so years, these numbers are going to increase.
It's going to increase.
Why in your case, taking a look at all in your experience, you've really interacted with quite a lot, not only in Kenya, but even globally?
You see, the increase in the cases of cancer globally, I told you urbanization is one of the most important factors. And there is no per se what is the particular reason, but urbanization and diet pattern. A lot of contamination in the food in the form of pesticides, all these preservatives in the food. Also, people having more of non-vegetarian diets, which are also preserved by chemicals. All those things globally. And you see the pattern, the climate pattern is also changing. It also has a lot of effect on your body as well as your growth and hormone levels of your body. So all these things, and you see, because of testosterone, as I told you, because of the diet, the processed foods and all, because you must have seen early puberties, most of the kids, is because of that, because of the diet pattern of more of the this junk foods and all this has created a scenario in the world wherein all the disease, maybe cancer, other disease like diabetes, blood pressure, everything is increasing. So overall the load of disease, maybe prostate cancer, is going to increase. Yeah, even in Kenya you can see the number of patients are increasing every yearly. And the death, maybe around 50-60% of the patients are, and the 100,000 of the male of the citizen are having these issues, which is going very high.
So do the death occur due to the complications of all this, or what exactly leads to the death?
You know that in malignancy,
is number one.
Yeah, it's number one cause in Kenya. The death is basically because of the metastasis. When the prostate grows and it spreads to the surrounding organs, to, like you can say, to liver, to the bone, and because of the prostate enlargement, it blocks the urine flow. Okay, so the kidneys are enlarged. There is called obstructive uropathy. So in this case, there will be issues of kidney failures. So the death, because of the cancer, is because of associated malignant spread and metastasis of the cancer.
Okay,
yeah,
right. So these are the numbers globally. But then let's come down to Kenya.
Yeah.
And finally, just take a look at what the numbers say. According to National Cancer Institute of Kenya, saying 24,400 males were diagnosed with prostate cancer. This is just as of last year.
Yeah.
And their average age at diagnosis is 70 years old. First of all, when you take a look at, let's say, 24,000 in your experience, there's a difference between those who will be diagnosed, and so hypothetically they might be even diagnosed at a later stage, because, as you say, it's not easy really to diagnose at the early stages. Between the diagnosis and those who actually get a cure, how do the numbers look like in experience?
You see, diagnosis, cure. First, say if you see the diagnosis of the cancer, you have written the average age of diagnosis is 70 years. That is too old, too late. You see, this has to come up. This has to be around 50. The average age of diagnosis of prostate cancer should be at 50. Now, if you do the early diagnosis, the numbers will go high. You see, because your diagnosis at the age of 70, you don't know what's happening from 50 to 70.
Yeah.
So the numbers, and most people after 70, those who have advanced cancer, who have metastasis, they also go into complication and they ultimately die. So if the average age is increased, these numbers will almost increase by 10 to 15%. So you can see around 30 to 40,000 males must be having a cancer in 2023 who are not able to diagnose at the early stage.
Right. Yeah. I'm going to have a caller right now. Someone from Nairobi, I didn't get the name. Hello, Deborah, habari asubuhi.
Hello, daktari.
Yes,
habari yako?
Anakusikia, endelea kama uko na swali.
Yeah, morning.
I want to ask a question to daktari.
Yes, please.
Hello.
Yes, please go ahead.
Yes.
Niko na my uncle ako na miaka 70.
Yes, continue Deborah, tunakusikiliza. Deborah,
ako na hiyo enlarged prostate.
Yes.
And it was not cancerous by the time it was diagnosed.
Okay.
So he is being advised to go to hospital and have a surgery so that they close the prostate.
Right.
So that it does not bring this infection and maybe grow to other places.
Right.
So my question to doctor is,
okay,
do you do this kind of surgery, and maybe how much is the cost of that surgery?
Right, Dr.
Okay, so what I got from your question, that your father has enlargement of prostate, it is not cancer, right?
Yes.
Yeah, so he needs a surgery called TURP, that is endoscopic procedure, by which we remove the blocked part of the prostate, which is blocking the flow of urine. That average cost of that surgery is around 160 to 200,000. It ranges depending upon how many days he's going to stay, but that is what the average cost of that surgery is here. Around 150 to 160,000 Kenyan shilling.
Deborah, if you're still on the line, I hope umepata jibu. Right. 0795-045-864 is the number to call us. We'll definitely be glad to get your calls if you have any feedback and particularly questions. Daktari atakuwa na jibu zote on matters prostate cancer. So that we'll take a look at, and you just explaining how these numbers look like. Yeah. But then when I was starting, I was saying many men would really shy away on
exactly. That is the main issue.
Even coming to screening.
Yes.
Do you think these numbers are quite lower than they should actually be?
It is tip of the iceberg, you can say. the numbers are tip of the iceberg. You see what happens for early diagnosis or screening of any prostate, there are basically two things what we do. That is called digital rectal examination, by which we go through your part and we check your prostatic growth by a finger. So most people are not comfortable with that thing. So that is why most males avoid those tests. Okay. And another simple test which if you do is the blood test, that is called PSA. You know, it's not very costly. It's around 1,500 to 1,800 shilling. Okay, if you do that test, you can diagnose around 80 to 70% of the early prostate cancer, by which we can get 100% or complete cure if it is treated on time. So if that is done, these numbers will almost double.
So I come to you as a patient and you give me these two options.
Yeah.
The digital rectal examination as well as the prostate-specific antigen PSA.
Yes, yes.
But then hold on to that. I'm being told you have Ruben kutoka Kitale. Ruben, habari asubuhi. Ruben, kama unatusikia, yes, I hope mute TV. I hope your TV is off. You can ask Daktari directly your question.
Nasema.
Yes, uliza.
Watu huwa wanasema ati lack of sex leads to prostate cancer. Is it true?
Could you repeat the question, Daktari kusikiliza?
Lack of sex leads to prostate cancer. Is that true?
Yeah, you see, it's not like that. It is like if you have more frequent sex, you know, the semen, which I told you, the prostate is the place where the semen is produced. The semen is a liquid in which the nutrition for the sperm is there. Now, if you don't ejaculate on a regular interval, those semen is going to be accumulated and those things are to be in the prostate itself. So regular, the study has shown if you have frequent and more sexual relation, or you can have, but not the partners. You see that is altogether different.
Can you repeat again, Nikombali na TV? Can you just go back again, please?
Yeah, it is true. Yeah, it is not like that case said true, but it helps you to prevent.
Umejibiwa, Ruben? Ama uko na more questions? Okay, ni kama Ruben amepotea. Thank you, Ruben, for that question. 0795045864 is the number to call us. So I was asking, you've provided me with these two options. The prostate-specific antigen, which is a PSA, as well as the digital rectal examination. And then you specifically tell me what is going to actually happen for the PSA, just the blood test.
Yes.
And then the other one, there is what now many men would really fear.
Yeah, the men usually fear is digital rectal examination. They feel uncomfortable to get it examined. So that is what is main thing, which enthusiasm is not there for them to go and get it checked and see a urologist.
Sorry to cut you short. So even as you continue the same, can you say one is more effective than the other?
Yeah, you see, even if you don't do a DRE, that is called digital rectal examination, just do a simple test by which a PSA. So PSA is more specific. Okay, it may not be very sensitive, but it has specificity is very high. It means if PSA is on the high side, okay, the normal range of PSA is from 0 to 4. Okay, so now if the PSA is on the higher side, there are chances that you might be having a malignant enlargement of prostate. So don't go for DRE. Don't be afraid of that DRE, that is digital examination. Just go for a simple test, blood test, that is called PSA. Now, once the PSA you are done, if it is falling into normal range, you are quite good. But that doesn't mean you don't follow it next year. It has to be done every year.
Every year?
Yeah.
For the PSA?
Yeah, every year.
All right. So hold on to that. We'll be broadening on that topic. Let's hear what Peter kutoka Malaba anasema. Peter, habari asubuhi. Peter, habari asubuhi. Kama unatusikiliza, I hope umemute TV ama iko off.
Nzuri sana, habari yako?
Yangu iko salama. Uko na swali au maoni on this conversation ya prostate cancer? I hope umemute TV.
Nzuri kabisa. Nauliza, how much does it cost?
Mute TV ama have it off tafadhali. Right. Tafadhali, when you're calling us, 0795045864, kindly have your TV off or just have it mute. Upana anza kujisikiliza. He was asking something about the cost.
Cost of?
Yeah, we didn't really get to know what he was asking, but then he was getting into the cost. But then you'll also be breaking it down for us. because I mean, here's a question that many men would be asking. So you're telling me that there's a PSA, which is the blood test, and it's just taking blood from me, and then it's quite specific, vis-a-vis the digital rectal examination, which I'd really have to, again, remove the clothes and all that.
You see, the digital rectal examination, when we do, we check the prostate size, we check whether there is a nodule or not. So it cannot be like more specific for cancer prostate. The nodules can be there in other infection or in chronic prostatitis or in a prostatic benign enlargement also. But when you do, that is a bit uncomfortable because you have to put your finger behind and then you have to check. So most people don't feel comfortable. So I will say, yeah, please.
Does it mean that if you were to do the PSA alone,
yeah, it's okay.
The things that you might miss if you did not do the rectal examination?
Yeah, if no, it's not like that. It is complementary to each other.
Okay.
If you do PSA and it is on the higher side, and if you do a digital rectal examination, and if you feel that there is, there's a consistency of prostate, which is a normal consistency. And if there's a consistency is not on the normal side towards on the hard and on the harder side, and if there is some irregularity on the prostatic capsule, you feel it is chances of cancer are there. Now, if PSA is high, and if you feel that from your digital examination, you assume that patient might be having on the cancerous enlargement of the prostate. So that gives a clear picture, not that he is having cancer, but it gives an assumption or it predicts that he might be having a cancerous prostate. Now he need to investigate it more to confirm that.
Right.
Yeah.
Hold on to that bit. Let's pick this call. Nelson, I believe, kutoka Bomet. Hello, Nelson. Punguza, all right. Kindly again, punguza volume ya TV, just have it off, have it mute, ndio pia tuelewane vizuri, ndio we have a very seamless conversation. You're saying it's complementary.
Exactly.
So that means if the doctor was to do the PSA, just the blood test, let's call it a blood test, so that even the viewer can understand.
Yeah, it's a blood test.
The blood test, vis-a-vis, so he will not have to do the rectal.
No, it's not like that.
Okay.
What I mean to say, you have, for screening, you have to do a digital rectal examination and PSA both. Now, how does both help? If you do only digital rectal examination, it might be a normal prostate from outside. Okay, the consistency may be normal. Okay, everything might be normal. But if you do PSA, it might be high. So you have to do both to get an idea that this patient, if PSA is normal, if DR is also normal, then you see, okay, it looks like more of benign. It doesn't look like cancerous. So he can be asked to be on surveillance, okay? Or every year you go for a routine checkup. Now, if PSA is high and digital examination is also showing some abnormality in the form of hard prostate, in the form of some nodules, irregularity on the prostate, it gives an idea to the urologist that there might be a chances of cancer. So now comes the another advanced test to go for like MRI, go for like prostate biopsy to rule out or to diagnose whether the cancer is there or not. Exactly.
Right. My next question was about cost, but I don't know if Wilson will be asking this. Wilson kutoka Nakuru, habari asubuhi. I hope your TV is mute. I hope it's off. If you have a question, kindly shoot it to Dr. Wilson, can you hear me? All right. Naambia pia huyo kindly again just have your TV mute or off. Sipo will have to just continue with the next caller. 0795 045 864 is the number. The first thing that you do when you call us, have your TV mute, have it off, then uliza swali yako.
19. Initially, I was put on hormonal therapy for 4 years.
Okay.
But seeing the PSAs were ever rising, until now we're talking of 1,400 units. I've been put on chemo.
Okay.
I've done 4 cycles, but the PSAs are still very high.
Right.
Physically, I feel okay. My body is okay. I feel strong, but the PSAs are an issue. Can Dr. help me? What do I do? What do I use? So that I feel okay. I'm getting anxious. The PSAs are just on the rise. Back when we are talking of 1,400 units.
Okay. Right. Thank you for that, Muhatia. These numbers are going to be increasing.
Yeah, numbers, but future is bright. A lot of research is going on in gene therapy, and in future we'll definitely see something called gene therapy, which will help you to cure it. A lot of research is going on. You see the SBRT, which I told you, the latest in treatment of prostate cancer since last 10 years. It is going very good result with minimum complication. Just walk in, walk out procedure every day. You come 5 sessions, you are done. No need for going for surgeries also. But prostate is also internal part. We check from kidney, we check ureter, we check bladder, prostate, and urethra. So whole kidney organ, that is called urinary tract, is taken care of. We don't miss prostate, but whole other parts of the organ of the urinary tract also is taken care of.
Right.
Yeah.
Thank you very much for your voice words. You could probably leave a contact that anyone, they definitely had quite a number of questions.
Yeah.
They can direct them to you personally.
It's okay, no problem.
If you don't mind.
Yeah.
Give us a contact, maybe a telephone number that they can direct all that.
Yeah, my cell number is 078-484-2055. You can call me on my number, or you can reach to my center, Jalaram Medical Services, which is located in Westlands, opposite Oval.
Right.
There we do all this treatment. We do all laser endoscopic surgery. We have in-house oncologist. We have very good diagnostic services there. So at one place only we can check, we can diagnose, MRI, everything.
Right.
Yeah.
Victor, you can read your number. Pole too.
078484205.
Right. I hope umepata hiyo. Direct all these questions and feedback that you have to Daktari. Thank you very much, Dr. Rajesh Chothari, as a consultant urologist and andrologist at Jalram Hospital. Still